Hey there, I'm Dr. Hagmeyer, and today I want to share some information on motility disorders, but especially I want to talk about something known as gastroparesis. Now in today's video, I'm going to review some of the symptoms of gastroparesis, some of the common complications of gastroparesis that we often see, how to treat gastroparesis without using medications, why the vagus nerve is so important, and how functional medicine really approaches this condition. So gastroparesis, first and foremost, it's a functional gastrointestinal disorder. And it's typically diagnosed based on something known as a gastric emptying scan or scintigraphy. It normally takes about 60 to 90 minutes for food to move out of your stomach and into your small intestines. And if more than half of that food is sitting in your stomach or remains in the stomach during that period of time post-meal, your doctor ultimately tells you that you have gastroparesis. Now, usually your doctor is also running an endoscopy, which is a flexible camera that's used to visually examine your upper GI tract. Very often patients have had an ultrasound to rule out problems with other nearby organs. But the problem with gastroparesis is that it affects the stomach nerves and it affects the muscles, right? Food moves through your GI tract by a series of muscular contractions, and this process is called peristalsis. But when someone has gastroparesis, those nerves and those muscles have essentially become paralyzed, right? In a sense, so that those wave-like contractions that push and propel food out of the stomach and into the intestines, it becomes weaker and it becomes slower. And this ultimately leads to food sitting in the stomach longer than it's supposed to. And this is where those symptoms of gastroparesis, including things like upper abdominal pain and bloating and constipation, nausea, vomiting, acid reflux, heartburn. Sometimes patients experience regurgitation. And most often people just report feeling full after eating very little of a meal. There can be weight loss, there can be loss of appetite. But the thing with gastroparesis is that it interferes with normal digestion. We also need to be aware of some of the complications. And as with most chronic health problems, gastroparesis comes with a whole list of complications that are really worth mentioning. Because the nerves aren't firing properly and muscles aren't contracting properly, you may develop unpredictable fluctuations in things like your blood sugar because of the way that food is being broken down and being processed and being absorbed. You may experience nutrient malabsorption or maldigestion. This often leads to vitamin and mineral deficiencies. You may also develop malnutrition due to poor appetite and weight loss. Some people with gastroparesis suffer with terrible vomiting, so they become dehydrated and develop all kinds of electrolyte imbalances. Other people with gastroparesis will develop bacterial overgrowth. Some people will develop H. pylori in the stomach. Others will develop bacterial overgrowth in the small intestines. And some are more prone to even viral gut infections. Some people can develop small intestinal fungal overgrowth, which is a yeast overgrowth or colonization within the small intestines. Now, if food doesn't get broken down properly, that undigested food then can harden, and that can remain in the stomach, and that can block food from passing through, and that can be a very serious problem. But this is where sometimes a functional stool test can be very helpful in underlying and understanding some of the effects that the microbiome has on relationship to other organs of the GI tract. Now, as far as natural treatment goes, from a functional medicine standpoint, it's going to be more focused on uncovering some of the root causes, some of the triggers, and also how to best support some of the complications that we often see and that are often encountered. You know, there's an old saying that says you can't fix something if you don't know what's causing it. Now, with motility disorders like gastroparesis, there are many different causes. There's no one thing that's going to correct the problem, and that's why you have to address this from multiple different angles. Now, obviously, different people have different root causes, so step one is, of course, identifying what your root cause might be, and that includes addressing some of the complicating factors that might exist, right? So let's talk about diet for a moment. Traditional medicine is quick to say that diet has absolutely nothing to do with gastroparesis, but I'm going to tell you that this is not my experience. While there may not be a gastroparesis diet that everyone can follow, all health and disease really begins with diet as a foundation. Diet can certainly be one of the triggers for a number of reasons. Because maldigestion and malabsorption are so common, vitamin and mineral deficiencies occur at alarming rates. Another problem that we often encounter are things like food allergies and food sensitivities. Now, don't be discouraged if you clean up your diet and you're not noticing improvement. Remember what I said earlier, that there are many, many root causes, and diet can create a problem in a number of ways. You may have a food allergy, you may have a food sensitivity. Certain foods could be high in histamine or high in FODMAPs. Some foods, again, may be high in oxalates. And so you may be reacting to food for more than one reason. So another thing to consider, and some other things that I think that are just helpful to you once you identify those offending foods and your nutritional deficiencies, are going to be things like establishing some sort of daily dietary eating routine. That means eating a breakfast, eating a meal in the middle of the day, and a meal in the evening, as well as appropriate snacks spaced out between those main meals. And this can be especially important if there are some underlying blood sugar issues that often exist. If you do have blood sugar problems like diabetes or hypoglycemia, avoiding, what you're going to want to do is you want to avoid missing meals that might cause your blood sugars to drop too quickly and then spike once you eat something. The other thing I recommend is that you keep a food journal to see if there are any obvious food offenders and how you feel when you eat those foods. Again, keep in mind that food is only a piece of the puzzle. Another factor worth considering is stress. Now, I've done several videos on the impact that stress and digestion have on gut health, and you may want to watch them at some point. But here's the deal with stress. If you suffered from a stressful situation, like the death of a loved one, a job loss, marital stress, or some other kind of emotional trigger or trauma, get your cortisol levels and get your adrenal levels checked, right? Cortisol has a tremendous impact on digestion. Stress shuts down the brain-gut connection, and that in turn can cause not only problems like gastroparesis, but other motility disorders like GERD, trouble swallowing, and irritable bowel syndrome as well. Now, there are a few videos that speak to these topics that you may want to view on my channel. The other thing is you want to make sure you're always chewing your food. I know that sounds silly, but you'd be surprised to find out how many people really don't chew their food as thoroughly as they should. They just swallow. So along with chewing food thoroughly, eat smaller meals, don't rush through meals, avoid overeating, and eating, of course, on the run. If you suffer with fatigue, brain fog, or any other type of classic thyroid symptom, I recommend that you get a complete thyroid panel that includes TSH, free T3, free T4, total T3, total T4, and to be tested for Hashimoto's disease. Autoimmunity is common in people with gastroparesis, and that's why if I suspect a thyroid problem, I run a complete thyroid hormone panel on every single patient that has digestion motility issues, because every aspect of digestion really is affected and influenced by the thyroid gland, and this gets missed almost all the time in patients who have gastroparesis. The other thing I want to really stress and mention here is that while the cause of gastroparesis is not always easily identified, damage or malfunction of the vagus nerve is a common trigger. And among the things that I just mentioned as common culprits, the vagus nerve, cranial nerve number 10, is the main nerve of the parasympathetic division of the autonomic nerve system. That's a mouthful. But that vagus nerve travels directly from your brain to the digestive tract, where it really helps control the contraction of the stomach muscles, helps slow down the breathing and heart rate, promotes relaxation, stimulates digestion, affects bile flow and hydrochloric acid production, affects the liver, and brings about a sense of calmness. And hopefully you can see why this nerve is called the rest and digest nerve. But when the vagus nerve doesn't work properly, it's going to interfere with digestion, it's going to interfere with motility, it's going to interfere with breathing, it's going to affect your heart rate, it's going to make you feel like you're stressed on a regular basis. This all ends up causing food to not be properly broken down, muscles of the gut to stop contracting, and peristalsis to slow down. Now, like I mentioned a moment ago, each and every person with gastroparesis is a bit different, and there can be many, many different things that have either damaged or are affecting your vagus nerve and causing it to malfunction. So let's talk about some of these factors that can cause vagus nerve to malfunction, because if you can relate to any of these, it's going to assist your doctor in the types of testing that he or she may need to run. Now, there's about 7 or 8 things that you should be aware of. So we've already talked about blood sugar, but it turns out that high blood sugar is also a problem for the vagus nerve, right? Diabetes or abnormal control of blood sugar when it's consistently elevated can cause problems with how the vagus nerve functions. Sometimes it's called autonomic neuropathy if it gets bad enough. But another reason behind the vagus nerve damage may be due to previous surgery to the esophagus, surgery to the stomach or small intestines. They can all damage the vagus nerve, affecting motility. Then we can have viral or bacterial infections that can damage the vagus nerve or cause malfunction, right? Stress is another big one. We have 2 branches of the nerve system, right? We have the sympathetic and we have the parasympathetic. Now, for people with motility disorders, including gastroparesis, we often find that stress and hormones like cortisol and adrenaline are typically elevated, right? So those are some things worth considering. Connective tissue diseases like scleroderma or lupus, those can affect the vagus nerve. If you're someone that has neck pain, neck mobility issues, headaches, ringing in the ears, or you have problems in the upper cervical spine like C1 or C2, This might be a compression issue of the nerve, or could be localized inflammation in the joint that's surrounding that vagus nerve. And lastly, there are things like stroke, MS, hypothyroidism, or Hashimoto's disease, traumatic brain injury, and last but not least, medications. Now, when it comes to medications, certain medications can slow the rate of stomach emptying and cause or exacerbate the symptoms of gastroparesis. These medications include opioid pain medications, antidepressants, allergy medications, nicotine, medications to treat high blood pressure. And so again, if you have any questions or you have concerns about gastroparesis, okay, talk about those things with your doctor. If you have questions, drop me a question in the comment section below. If you have questions about becoming a patient, you'd like me to review your case, you can reach out to my clinic by visiting my website. If you like today's video, there's another video that I highly recommend that you watch. It has to do with improving motility and digestion. You can watch that right here.